AMBOSS platform. I usually, with these webinars, go through what AMBOSS is and why it can help students, but today I'm just going to focus on some actual tips and sort of a platform walkthrough. So first of all, for anyone who missed the very beginning, hello and welcome. I'm Dr. Tanner Schrank. I'm one of the AMBOSS partnership managers, and I'll be talking with you today about how AMBOSS works and how you can use it to improve medical education. It's a really helpful tool for medical students of any year, even after you graduate. I can personally say this because I found out about AMBOSS when I was in medical school. So I'm from the US, but I studied medicine in Poland, and I found out about AMBOSS in my second to last year, and then I became sort of like an AMBOSS representative at my school, and now I work with AMBOSS. So I can tell you that it really works. And today I'm just going to give you sort of a walkthrough. So if you have gotten this link before, we have a special page just for your school, and it explains all about getting access to AMBOSS. So it's really easy to follow all the instructions. You can scroll down and then make an account if you don't have one yet, or log in and then activate your campus license. And you have to select your school and then enter your email address through your university, and then we will activate it and confirm it. And then you should be good to go. And then you can use AMBOSS on the web, or you can download our two apps. So we have an app for our knowledge library and one for our question bank. And each one works separately, but you can go in between them if you download both of them. Okay, so these are some of the major features I'm going to show you today. There's highlight, overlay, attending tips, and things like that. So let's jump right in. Once you go to amboss.com, then you should see a landing page like this, and you can log in, and if you click the login, you'll enter your email address and make a password. If you already have one, then you can just log right in, and if you're already logged in like me, then it will take you to your dashboard, and that's what we're looking at here. So on your dashboard, you should see a navigation bar on the side, on the left, and then you should see the last things that you were studying right on top, if you've used AMBOSS before. And as you can see, I was studying pediatrics recently, and if I want to, I can jump right back in to my neonatology section. I was reading these 9 articles and doing these 23 questions, so I can jump right back into that if I wanted, or I can scroll down and see my performance as of today. So right here, you can see how I compare to other students with the same study goal as me, and it will tell you your percentile. And then on the right here, you can see how many questions I've done, how many I have left, and how many I've gotten right or wrong. And this number is over 5,000 because my goal right now is general studies. That means I get all of the questions, but your goal might be an anatomy exam, or some bigger exam like the USMLE, or maybe it's just like a Pediatrics Clerkship, like I have listed here. And if that's set as your goal, then we'll tailor our analytics tools to that goal. We'll tell you how many questions you need to do to be prepared and how many articles you need to read. It's all in our analysis tab, but you can see a snapshot of it right here. You keep scrolling down, you can see recent articles I've read and recent question sessions I've done. Now, if you're using AMBOSS for the first time, what you're going to want to do is go to the library and just maybe browse through our articles, and this way you can see what you're going to be focusing on, what you're going to be studying. And if you set your goal, then these should be tailored to your goal. If you're in your first couple of years of medical school, then you're going to want basic sciences, right? If you go by discipline, you can see anatomy, biochemistry, physiology, all of these, and you can browse by discipline, and then you can pick what system you want, and then you can go right to that article. So let's go to the liver article. If I click that, then it will open up the liver article right here, and all of the sections are minimized, and there's sort of a table of contents over here on the left. I can close that, and I can expand all the sections, and we can see all the information about the liver. And right away on top, you might notice these little toggle switches, and these are if you want to change the information that you're seeing. So I'll start with all of them turned off, and then we'll just turn them on as we go. So right away, you get a general description of the topic you're reading about. So the liver, we get a general structure, the gross anatomy. And then there's some images as well, of course. And if this information is too much for you, maybe you're preparing for an exam already, then you need just the need-to-know information, right? The really important things. Then what you're going to want to do is turn on the highlight mode. And this will tell you the most important things on this article. And that would be the portohepatic structures. And you can see as you scroll down, it's some of it's highlighted, some of it's not. If you just want to look at the really, really important things that are definitely going to be on an exam, then you're going to want to turn on the high yield mode as well. So this just removes all the other information, and you're basically left with the highlighted stuff. And this really condenses it. It makes it much easier to just study the important information and move on. And let's go into one of these pictures that we see here. So this is the structure of the liver, right? We can see it's just like in any textbook. You get all the different lobes and all the different ligaments and vessels and bile ducts and all this. And if you're in study mode, it might help to just learn it this way. But if you're in like exam prep mode, if your test is coming up really soon, you might want to quiz yourself on this stuff. So you can turn off the labels, and then you would have to produce all of these names for all these different features. And if you want us to ask you the questions, you can turn on the quiz, and we'll ask you which section is marked in the image, and you have to name that, click on it, and then it will ask you the next section. Okay? So a lot of these images are interactive in that way. You can do a quiz right through the picture. And we also do that with our tables. So I'm going to scroll down to a table. And if you look, we can see the vasculature collected here in the table. We can maximize it, so we're just focusing on that. And then if we want to really test ourselves, see if we know the arteries and veins in the liver, we can start a quiz. And it will blur the information, and we have to produce it. And when you click on the cells, it opens up the information. And we can really see if we learned anything. Okay? And if we finish that, we can exit and we go right back to the article. And as we're scrolling down, we can see more images, some useful information to help you remember things. And then you might notice this little red dot here by the Notes tab. That means that I have written down some notes and I saved them, and they're accessible every time I come back to this article. So I had written, my professor loves to ask about this, so I saved that for myself, so I remember to study that for next time. And save it and come back to it. And then right next to that is our feedback button. If you see a typo somewhere or you have a question, maybe a name, an older name for a structure is used, one that's been, a new name like the fibula. There's some names like fibularis. There's an older name, so maybe we use that somewhere. You can tell us, and we'll take a look and fix it, or we'll let you know why we haven't fixed it. So our feedback is how we can constantly update information, and we can get to know our users as well. All right, so we keep scrolling down. We get more information, and here we come upon some histology slides. And these are always a little difficult because it's hard to know exactly what we're looking at, right? There's a lot of cells on here, a lot of features of the cells, and there's some arrows and numbers, but it might not be immediately clear what we're looking at. So of course you can access the caption, like any good textbook has a caption, and you can read about what we're looking at. And then it says arrow 1 points to this, arrow 2 points to this. And on some of our images, we even go a step further and we highlight exactly what we're talking about. So in this picture, you can see the caption kind of tries to explain what we're looking at, but it still might not be 100% clear. So you can turn on the overlay tool, and that is really going to help you focus on what we're talking about. So you can see blue overlay is the ground glass hepatocytes, okay, right here, here, and here. And then we have green overlay is the liver cell necrosis, okay, so all over here. So that should help you zero in on what we're talking about. All right, and then in some histology slides, you might want to zoom in, right? You might want to get even closer. So with this, if I zoom in with my browser, it's like any picture. It's going to get blurrier and blurrier, right? It's not very clear what I'm looking at anymore. So I'll zoom back out. And AMBOSS has tried to replicate what it's like to actually have a slide under a microscope with our smart zoom feature. You click on that, you get a slide, and then you can double click. And every time you do that, it will zoom in and the resolution will refresh. So it stays clear at every level of zoom. So this should really help with these slides. So you can get down to the cellular level and see what's going on. And you can pair that with the caption and the overlay. All these features can stack on these pictures. All right, so we'll keep scrolling. Keep scrolling, keep scrolling. And oh, here we have a video. And on AMBOSS articles, we have two kinds of videos usually. We have videos from Osmosis. If anyone studies with the other resource Osmosis, we have an agreement with them where we can use their videos in our articles and they play within the same tab in your browser. And then we also have our own videos called Chalk Talk, where we take hard to understand concepts and we try to animate them and make them easier to understand. So this one is ethanol metabolism. If I hit play, it will play in the same browser. And if I wanted, I could open it on YouTube. I could change the playback speed. I know it's very important for a lot of people. I can speed it up and I can play it. And I don't have to open up a new program, a new tab, or anything like that. It's all here and I can go right back to the article. All right, so I'm scrolling down, and I see some more pictures, some ultrasounds. These are really helpful when you use the overlay function. And then right at the bottom, we get to the references. And of course, if you want to read up more on any of this, you are free to follow our references. And maybe you want to read some Gray's Anatomy, find out more about the liver, or you're wondering how this compares to other textbooks, other resources. Well, we've cross-referenced it with first aid for the USMLE, and so you can trust that the information is covered here. We also try to keep it up to date with information from journal articles. You can read them right here, and other textbooks. It's all in the references. So that's really, really nifty, I think, because you can see what we are writing everything from and when we updated it, and things like that. All right, so let's say we read this whole thing and now we're experts on the liver, right? We want to test that. So we can jump right to a question session with this button here, QBank session, or we can go over to QBank and make our own custom quiz. And this little progress bar with red on it means that I've done some questions about the liver already. and it says that I did one of them. I got it wrong, so it's red. Well, since I've done that, it activates another feature called the learning radar. If I turn that on, then parts of this article, which were needed to answer those questions correctly, will be highlighted in red because I got them wrong. So here it is. I got a question wrong about zone 3, pericentral veins, and so this will be underlined in red until I get that question right. So I can really focus on my weaknesses, make sure I get these questions right in the future, and then move on. For now, let's jump to a question session on the liver. And then I can set up this session. It tells me my study goal, and it lets me pick what kinds of questions I want. So I could go with only new questions, or I could go with questions I've gotten wrong, anything like this. And I can choose how many I want. If I want to further customize it, I could hit refine here. But for now, let's just start so we can see how the questions work. All right. So we're now in the QBank already. It's open in the same tab. We don't need to change apps or anything. Our questions are listed on the side here, and our timer is already going on the bottom left. So we need to read this question, answer it as quickly as possible, try to get it right, and then move on. And we can close this navigation tab and get into the question. Now, if you've taken any of these bigger international exams like NBME exams or USMLE or other ones, then a lot of them have tools that you can use when you're taking the test, right? You can highlight information in the question, you can rule out answers, you can look at lab values. All of that is in the test. Well, we tried to replicate that in our QBank as well. So let's go through this question and look at some of the features. So a 63-year-old man with diverticular disease comes to the emergency department. Maybe we think that his demographic information is important, so we'll highlight that. Maybe his current disease is important. And we can just keep going and highlight as much or as little as we want. And a lot of students will wind up highlighting everything because they think it's all important. And you can click on any of this to get rid of a highlight. But if you're a student like this who highlights everything, maybe you want to know what someone else thinks is important. Well, at AMBOSS, we did that for you with the key info button. Click on that, and the important information for us is underlined in green. So now you know what is really important to answer this question correctly. And so his pulse, his blood pressure, his bleeding, and then a couple of his lab values are important. And if we want to double check what a normal ALT, AST is, we can open up the labs and find it right here. ALT, reference range, yep. Okay, that looks different. And then we can get right back to the question. And then we can look at the answer options. So a lot of students, as feedback, they tell us that the AMBOSS questions are really hard. And part of that is because we give you so many answer options. A lot of these exams, they give you A through D, A through E, but on average, ours are more than that, A through F, G, H. Some of them go all the way to J and K. So you really need to know the answers, and that's by design, because if you're studying with harder questions, when you're in the exam, it should feel easier, and you should be more prepared. So let's just take a guess here. Let's go with the first one. Hepatic stellate cells. We got it wrong. But the QBank didn't just tell us what was right and then we move on. We can read here why we got it wrong. So it tells us a little bit about these stellate cells, and it gives us some information about how it relates to this patient, right? So you can think about that and think, okay, what would be different? Why would that be the right answer in a different situation? Things like that. And because we got the answer wrong, the attending tip automatically opened up. Now this is really, really helpful, I think, because when you're actually in a clinic or in the ward, you're standing around with the attending or the professor, and they might ask you a question like, for this patient, it was which cell is most likely damaged first. And if you get the answer wrong, if you give the wrong answer, they don't want to just give away the right answer. They want to push you down the right track for you to get the answer right on your own. And so that's what we call the attending tip. It gives you more information so you can get the answer right, but it doesn't give it away. So here we read, okay, extremely high transaminase. So that should point you towards ischemic hepatitis. Now that might help you. It might tell you, okay, it's definitely not periportal hepatocytes. We can rule that out. We can rule out hepatic Kupffer cells. We can just go down the line and take a guess. So let's say we just take some wild guesses here, and we finally get the right answer. So along the way, we could read about every wrong answer, even after we get it right, and we can find out information about all these liver cells. And then we can read information about the right answer. And for a lot of these, there's an extra step, right? This question is about the liver, it's about the cells, and you might be asking, okay, but how do I treat this patient? Or, okay, that's the diagnosis, but what are the complications of the management, things like this? A lot of that is under the additional info button. And so this one is about cytochrome P450, so we can find out more about that. You can always close that and click on this image if we want and find out some more information about these liver cells. And you may have noticed this little percentage popped up after we got the question right, and it's next to every answer. And this tells you how many other students selected that as their correct answer. So if 71% got it right, that tells me that it's probably on the easier side, right? If we want to double check that, we can open up the list of questions, and every question gets rated on difficulty from 1 to 5 hammers. This one got 2 out of 5, so it's pretty easy. You'll definitely know when you get a 5 hammer question. Those are really, really tough. But for now, we got this one right eventually. And if we're still confused, we got it wrong again, and then eventually right. Maybe we're thinking, how was I supposed to know this? Well, if you click on the article link here, liver, it will open the article next to the question. It will scroll down to the exact information you needed to get this one right. And it turns out it's that information I showed you earlier, zone 3, pericentral vein. I still didn't get it right. So that really helps you save time. It directs you right to your weaknesses. And you can commit that to memory so you don't get it wrong again. Maybe I should do that for next time. But let's move on to the next question now. And we only have 2 in this session, so we'll just take a guess quickly. It's a very short one. And we got that one wrong too. We can go to the analysis. And then we see how we did. It tells us how many questions we completed, how many we got right, how long we took, how long per question. So if you're trying to prepare for a big exam, you really need to be aware of how long you're taking on every question. I got that down to 92 seconds, so that's pretty good. But in the actual exam, you need to keep it really low. And then it tells me how many questions I got right, how many questions I got wrong, how many I got right with help. So when we say with help, we mean key info, overlay, attending tip, all these extra bonuses we give you that you don't have on the exam. And then it tells me how I'm doing compared to everyone else. I keep getting that question wrong, so obviously I'm very low compared to everyone else. But then we can see recommended study recommendations. And this part is really cool because it tells you exactly what you need to focus on. So of course we got here from the liver article. All the articles I need to focus on would be liver, but we can click on that and find out exactly why it's recommended. And it's recommended by priority, by percentile. You saw that I was low on the percentiles. by how many questions are on this topic in my study goal and how many I've done already. So that changes the recommendations here. We can also look at study recommendations by discipline, by system, and when you only do 2 questions, this isn't going to be very helpful. But if you go to the study summary, this tells you your entire analysis, your entire performance. So you can see I've done 116 questions, and I'm in the 2nd percentile, and I've gotten 21% right with help. And then when we go to study recommendations, we can see a little bit more how the analysis works. So if we look at bacteria, I've gotten some right and some wrong. And so it has mixed priority. So it's a little down the list, but it's still important for me. We can also go by discipline. We can see that I need a lot of work with family medicine, but not so much with something like pharmacology. We can also go by system, and we can see I should focus on the brain and the lungs, but not so much on bones and joints. So this is really helpful, I think. And if you wanted, you could just use this to make your question sessions. You can just go right to the QBank, do 40 questions, and start it. But for now, I'm not going to do that. I'm going to show you a couple more features. So we went from the library article to the QBank custom session to the analysis. And you can see that they're all interlinked. You can jump from one to the other super easily. And if you ever have an actual topic on your mind that you just want to jump to right away, you can type it in up on top. It'll take you to the article. And let's say I want to read up on pneumonia. Type it in, click on it, and it will take me to the article. And here we have a couple more features that I can show you, like one of those osmosis videos. It plays right here. If you're a visual learner, this might be really helpful. And then sometimes we have a quiz attached to the video, but sometimes not. And once you've read an article, you can mark it as learned. You can always change the font size. You can do all these extra features. And eventually, you're going to want to make your own quizzes, your own custom sessions, right? You read enough articles, you want to see how well you're doing. So we'll go back to the QBank, but now we see a couple different features. We see that we can make our own session, or we can do a university session. Now, my university doesn't have campus license, so this isn't going to show me any information, but in that spot, you should be able to see custom quiz sessions that professors set up, and then they want you to answer questions that they pick. For now, I'm going to make my own. I can choose what questions I want based on my exam. Maybe I have an anatomy test coming up, want to study for that. And I can pick what system I want. Let's go GI. I can even go by symptom. So maybe I have questions about just general nausea and vomiting. And then I can go by discipline as well. I could just go, let's just go pediatrics. So we're getting very, very narrow here. We can also go by article if we have one in mind. I was going to try to load all of the articles. Or we can save any questions that we really like for later. So you can see I've made a whole bunch of folders, and in these, there are questions that I really liked and I saved. So I could add some, I could just add all of these. But then we're going to have a very narrow range. Yeah, no questions. Okay, let's get rid of the folder. And we can also go by difficulty. So here are those 5 hammers again. And I want just some easy questions. We can go by status, right? Only new ones, only ones I've gotten wrong. And we could even go by only ones with pictures if for some reason we really wanted to do that. And then we can rename this. and then we can come back to it later. And by default, it's going to put a maximum of 40 questions per quiz, but you can change that. You could put up to 1,000, you can put 5, whatever. And you can go back to study mode like we were in, or you can try exam mode. Now this is supposed to replicate what it looks like when you're actually taking one of these big international exams. And you can see that it has all the same functions that you would expect. You can still highlight, you can open lab values, you can invert the color if you really want. You can tell us that that's what you want to do. And you can answer the questions, you can mark them, come back to them later. But what you can't do are any of the special AMBOSS bonuses, right? You can't get key info, you can't get the attending tips, you can't get the overlay function. And when you answer a question, it doesn't tell you if it's right or wrong, you just move on. So I could answer these, move on to the next one. And then when you're done, you can end the block, you can pause it, you can remain here. But as soon as you end it, you're taken back to our analysis tool. So you still get all the analysis features, you just don't get the study features. Okay. And then we find out how well I did, what I need to focus on. So that's a pretty quick overview of how to use it. I can go into more in-depth tips if you would like. I know there's a lot of features that people don't know about. There's our study plans. So if you are wondering how to study for one of these exams, you can see that I like to study pediatrics a lot. So I have this study plan available. It takes me through all the pediatrics questions in 40 question blocks, and they're by discipline. And I can just do nervous system questions, 40 questions, start it, finish it, and then move on. Or if you're in one of our courses, we structure those a little differently. Pediatrics Clerkship. These are tied to articles. So if you're doing it this way, you read the articles, there's only 9 here, and then you do the questions, and then you move on to the next block. Okay, so that's a quick look at our study plans, and you can also go by exam if you want. So if you're in the first couple of years, you're going to do basic sciences, so that would be our USMLE Step 1 study plans. If you're in later years, you're going to have USMLE Step 2 CK, which is clinical knowledge. So that's like, what's the treatment plan for this? How do you manage a patient with this? And if you are very late in your medical studying, you're going to want Step 2 CS. So that is clinical skills. And now these, I don't think a lot of people know about, but we have clinical skills training in our platform as well. So if you want to know how to do a neurological exam, we have an article on that. If you want to watch a video on how to auscultate the lungs, we have an entire article on that. And then we have some questions tied to these, but they're a little different than the rest of our library and questions. I'll just show you really quickly how that works. So we're in the clinical skills section, and we're looking at a physical exam. We can see that every part of the body is broken down here, and most of them have videos on how to do these actual clinical exams. So here's one on the thyroid, and it takes us through with a mock doctor, a mock patient, and we can see exactly how to do it. You can close that and get back to the article. And then when you're ready to test yourself, you can go back to the clinical skills study plan and look at these cases. So we take 40 clinical cases and we break them down into sort of a mock encounter. So let's look at case number 1. It's about abdominal pain, but it doesn't give you the actual diagnosis. You have to figure that out on your own. And the way it's set up is it's best to study with 2 people. One is the mock patient and one is the mock physician. So the physician gets this information, and you can see what's really important. If you have highlight on, or if you want to test yourself, you can turn that off. So this is a patient that comes to you, these are their vitals, and this is your task. Take a history, take a physical, but don't do these because it's just a mock patient. And then explain your findings and your plan and write a note. Okay? And then these are the instructions for the patient. So if you're studying with a friend, they would get this section. And then it tells you how to take a history. So you start with what brings you to the hospital today or something like that. And then if they say pain in my stomach, you can check that off. And you can go down the list and treat it like a checklist, and then make sure that you're covering every aspect of the history. And you can see that there's a lot of information in the history. And then eventually you get to a focused physical exam. And to make sure that you do it properly, we break it down into step-by-step tasks, right? Wash your hands, use respectful draping, inspect their sclera. And if you want more information on that, you can hover over the speech bubble and find out why, or tips on how to do that. Okay, so you're going down. If you're not sure, you can watch a video on how to do it. And then we also check your communication skills. Make sure that you knock on the door, you show interest, you make eye contact, things like this. And then when you're all done with that, you can write a note. And to do that, we made our own little mock patient note. And I think this is really, really helpful because, at least in my education, we didn't really get much prep on writing notes. And we never had an actual form to fill out that counted how many characters we use, how many lines, and then that told us in the end what we should have written. So for this, we can say Marcia Billings is a 47-year-old woman presenting to the physician, whatever, right? We write our physical findings. Patient presented with pain in the stomach, or maybe right upper quadrant, something like that. And then we figure out some diagnoses. So maybe appendicitis, maybe cholecystitis, and then we have to tag the findings from the history and physical to the diagnosis. And then if we scroll down, we can make as many as we want, and then we can order some studies. Maybe we want an ERCP, maybe an abdominal ultrasound. We can keep adding more and more studies if we want. And then when we're all done, we submit it. And then we find out what the AMBOSS recommended patient note would look like. And so this is what I wrote, and this is what AMBOSS says is recommended. So we can see the history, the physical, and then the diagnoses. So we have a whole differential diagnosis here with findings linked, right? You can see, oh, positive Murphy sign points to this, and so on and so on. And then at the very bottom, we would see the diagnostic studies, ultrasound of the abdomen, ERCPs last. So we can see how well we performed based on the AMBOSS recommendations. We could print that out if we wanted, or we can escape and go back to the case. And after you're done with a note, you should have 10 minutes to write all that. Then you do further discussion. And this is really cool too, because it tells you more about the differential diagnosis. It tells you why you should think cholecystitis, why you should order an ultrasound. So you can follow up on all the things you just learned in practice. And then you can mark it read and continue, move on to the next case. So that's really helpful for students later on in their medical education. And we also have, study plans for basic sciences for those earlier. And even after you graduate, we have a lot of content for physicians and everything in between. So I think that's a quick and dirty show of how AMBOSS works. Do we have any questions for me so far?
Yeah, I have one question.
Sure.
What is the most effective way to use this site, this engine?
So most effective way, I would say, would be set your goal. So you can do that under your account, your profile. You set study goal to be some exam or some course you're taking. Save that. And then go through our study plans and go just step by step, read the articles. And then when you feel ready to answer questions about the things, then do the custom sessions. For some people, it's going to work better if you go straight from article to question. But if you're getting close to your exam, I think it's better to do timed random sessions, right? So if you have an anatomy test coming up, maybe you need to study both the lower limb and the upper limb. Well, it's not going to benefit you to just do questions on the upper limb. You're going to want both. So I would make a custom question session and then see how I'm doing and go back and review the questions I got wrong and move on to the next one. That's how I used it. That's why I would recommend using it.
So would it be great, for daily use or for like preparation for exam? Maybe it would be better, right, for the preparation for exam.
I think it's definitely helpful for preparing for exams. For daily use, I would recommend maybe pairing it with something else. So if you use Anki, like flashcards,
right?
Yeah, we have an Anki add-on. You can download that, and if you just Google AMBOSS Anki, we have a page where you can download our add-on. And so you're doing your flashcards in Anki, and then if you have a term that you're not familiar with, or you get a question wrong, you need to learn more about it, you can hover over it on your computer, and then the AMBOSS definition will pop up. So I think that's really helpful for daily use. And then you're kind of using AMBOSS when you're even not in the actual platform.
And also, Tanner, if I can also add to your explanations, especially for Saba, for daily use, also the library section is very helpful because whenever it's reality, whenever you are following the lectures, sometimes during the week you have not enough time to go into the deep detail which is described in the textbook. But AMBOSS, which gives you the comprehensive, not enough references for the full preparation for midterms as well as the final exam, but gives you the possibility just to exactly keep in mind the very important mechanisms as well as the explanations. Those you memorize from the lecture as well as seminars, but just to have the deep memory pattern, it will be good just to look over and read once again. Tanner, excuse me if I am not correct, please add me.
No, absolutely. That's a great point. Yes, I completely agree. And if you're treating it like that, if you're reading it every day or in conjunction with the lectures, then you're going to want to browse the library. And it's helpful then to know what you're looking at, right? So basic sciences and clinical sciences, those are kind of self-explanatory, but the other ones are helpful too, depending on where you are in your studies. So if you're, let's say, in your last year, you're doing clerkships in the clinic, you might want our clerkship survival guides. And these are a little different than a normal article, and they're more of an explanation of what you're going to see on the clinic. So you can just read these really quickly, just at the start of your day before going into the, in this case, internal medicine ward. And then you know what to expect. You know what skills to practice. So I think that's pretty helpful too.
Thank you.
Yeah.
And Tanner, I have one question from my side. The university study plans, university portion is just new for us even. So in such case, I have two questions which I am interested about. Difficulty of the questions. If I understood correctly, students by themselves can choose the difficulty of the questions, those they are practicing. Am I right?
Yes.
Okay, but in case of the university decisions, in such case, students by themselves are making decisions and lecturers from our side are making the different ones, or at concrete time it will be combined?
So the lecturers can make sessions that they recommend the students do, and then those are set. So the students can't change only the easy questions or anything like that. It would be like doing one of my previous sessions. And then students, in addition, can make their own sessions if they want to do extra practice.
Okay, okay, I see. Guys, any more questions from the auditorium? Yes, Saba, you have?
Yeah, I have a question to you, Ms. Seka. Do we have like any kind of study plans done by university? As Mr. Tanner said, there have like university, like there's a section by university. Does our university have?
I think yes, because as we are right now in the process of the wide-scale usage at the TMA of this platform, yes, why not? We can issue in the different teaching courses just to ensure that all of you will reach and achieve the same learning objectives, not depending on the lecturer approach. It will give us the possibility to standardize the teaching process.
Yeah, I think it will help us too.
Okay, and I have, Saif, if I may to you, you like the just freshly graduated student, and today you followed us during the presentation. Maybe you see something which should be asked from Tanner level right now, because I'm far from the studentship. Maybe we missed something which you like the just graduated one have a question about these possibilities of platform.
Actually, for now, whatever I've seen, which was very interesting, and I think it will be very, very, very useful to our students. I think it is more than enough, but I will check it out as well, and if so, I will give my feedback if possible.
Okay, and I hope that Tanner, we can contact you just to find the ways how to more efficiently use this platform. Thank you, Sai. Thank you.
Thank you, and thank you for the very interesting webinar.
Of course, my pleasure.
As I see in chat box, we have no questions. So, if someone has the question, please raise your hands.
If anyone has any questions later on, they can also email us. If it's a question about like a problem with your account or AMBOSS or something, it would be best to go to customer support, and that's hello@amboss.com. Otherwise, you can email me, tls@amboss.com, or I think you have Caroline's contact information. She set all this up, so she's super helpful as well.
Yeah. Thank you very much. Excellent team with excellent solutions. So good luck for you in the furthering development, and thank you to be with us.
Thank you very much.
Thank you
very much for the opportunity.
Yeah. Okay, enjoy the evening as well as the weekend. Have a nice weekend. Thank you very much.
Bye-bye.